Welcome to the Health Zone. My name is Dr. Toju Chikiobi, but everybody calls me Dr. Toju. We have a terrific show for you today. We will be talking about stroke. And please, before you decide you don't want to hear about stroke, stroke is so important. Do you know that it is one of the top 10 causes of death in sub-Saharan Africa? In fact, not only is it one of the top 10 causes of death, but it is preventable. So you don't want to miss this episode. You want to learn how to prevent it. We have so many great things on today's episode. We'll actually hear from someone who has personally experienced stroke. So that's important for us to learn about. And then we have a terrific guest today, a neurosurgeon who is passionate about stroke and has worked for many years on this subject. In addition, of course, we have the fun part where we go out to the man on the street and find out what it is that they know about stroke. So please, you don't want to miss this one. Stay with us. Welcome to the Health Zone. On today's episode, we will be talking about stroke. And we have a terrific guest with us here today, Dr. Biodun Ogunbo. Dr. Ogunbo is a neurosurgeon that is a brain and spine specialist, and he is the medical director of Spine Fixed Abuja, which is a special purpose vehicle designed to promote safe spine surgery in Nigeria. He's also the public relations officer for the Nigerian Stroke Reference Group. So you can tell that stroke is really a passion of his. He's widely published in medical journals, and he's a real advocate for helping the ordinary person understand the neurosciences. We are really honored to have him with us today. Dr. Ogunbo, welcome to the Health Zone. It's such a pleasure to have you here with us today.
Thank you very much. It's a pleasure to be here.
So, as is our usual custom on the Health Zone, we will go out to the street to find out what the man and woman out there know about stroke. It's our man on the street segment. So please don't go away. It's going to be really interesting so that we know how much work we have to do, how much explaining we have to do, or maybe people know enough about stroke and we don't need to talk too much about it. But either way, it's going to be fun. It's going to be interesting. So don't go away. Let's watch the video together.
Today we will be talking to the man in the street. What is a stroke?
Stroke is when you have a clot in the system, I believe. It actually causes paralysis or death.
What kind of people get strokes?
Virtually anybody can get stroke. It's now known that children as young as 20, in their 20s, do get stroke. It depends on lifestyle and a lot of other things.
How do you know if you have a stroke?
If you have stroke now, you're paralyzed. The blood can never move part of your body. Half of your body will stiff. And that's stroke.
Do you think that strokes can be prevented?
Yes, possibly they can. Stress is the main source of stroke. So if you live a stress-free life, you might be able to prevent stroke and have your blood pressure checked regularly.
Okay, so we saw some really interesting things on the Man on the Street segment. It seemed there was a little bit of knowledge out there, some of it incomplete. So you tell us, you're the expert, that's what you're here for. What is stroke?
Well, I'm actually happy that a few people know something about stroke. But for the general public now, stroke is paralysis of the arm, paralysis of the leg, problems with speaking, confusion, sudden severe headache, but all of these are caused by lack of blood supply to the brain. So if we look at our brain, different parts of the brain do different things. So everybody can suffer different types of stroke. So no two strokes are the same because it affects a different part of the brain. And it depends on what that particular part of the brain does will be the effect that you get when you have a stroke.
Okay, so what causes that problem with the brain? What causes the stroke in the first place?
Stroke is caused by any interruption to the supply of blood to the brain. And that, in most cases, is because of hypertension. Hypertension can actually damage the blood vessel and so interferes with blood supply to the brain.
Okay. I've been told, though, that there are two ways in which that damage occurs, right? And so can you explain that, a little bit? There are two kinds of ways that the damage occurs to the ischemic and the hemorrhagic. So break that down to us in everyday terms.
Yeah, those are big terms, but people should know them. People should know that there are two types of stroke. There's ischemic stroke, there's hemorrhagic stroke. Put in a different way, there's dry stroke and wet stroke. And if we use pipes going into a house, for example, if there's no water going to the house, so there's dry pipe, there's dry stroke. If, unfortunately, somebody has turned up the pressure, and so now there's water flooding the whole house, that's wet stroke. So we have dry stroke, wet stroke, ischemic stroke, hemorrhagic stroke.
And high blood pressure, hypertension can do one or the other.
Absolutely.
Okay, so what are some of the things that puts you at risk for stroke in addition to hypertension?
Well, in addition to hypertension, we have diabetes. Diabetes can also increase your risk of stroke. People who smoke have a risk of stroke. Us just being black, our race also puts us at a risk of stroke. Women, for example, who take oral contraceptive pills, they also have a higher risk of stroke than the ordinary person. So there are so many different factors. And if we even look at us here, younger people have a risk of stroke because sometimes of sickle cell disease, which can lead to blockage of blood vessels going to the brain.
Okay. So what are the sort of symptoms that you get from stroke that would be a clue that you have stroke or you're developing a stroke?
Well, the commonest symptom for stroke really is weakness of an arm or a leg.
Okay.
But other people can have blurring of vision.
Okay.
Some elderly people can have just confusion. And all of those could be because of dry stroke, for example. Now, when we talk about wet stroke, because that increases the pressure inside the head, since there's bleeding inside the brain, they get a massive headache. So sudden, severe headache. And this is important. This kind of headache, people would describe it as they've never had that kind of headache before in their life. So it's not like migraine, for example.
Yes.
So sudden, severe, horrible headache that you can't bear, you can't live with this. You need to check to make sure it wasn't a stroke.
I know that there is something called a mini stroke. So what is a mini stroke?
A mini stroke is a small stroke.
Yeah, mini,
but
of course.
Essentially what it means is that you may have had sudden blindness or sudden weakness or paralysis of an arm or a leg, which goes away. And that's the fundamental thing here, that the symptoms go away.
Like how soon?
Within an hour, certainly within 24 hours, you become completely normal. However, that's the real danger, because that's actually a warning sign. So a mini stroke is a warning that there's a bigger stroke coming within the next 24 hours, certainly within the week, within the month, within the 6 months, or for a lot of people during that year, there's a bigger stroke coming.
So what are the other complications from stroke other than paralysis?
Well, apart from paralysis, it could lead to permanent blindness. It could be, hearing loss, problems with memory. Definitely, some people have problems passing urine or passing stool. And, you have paralysis, for example, which could keep you in bed. So you lose, you can lose your job because of this. You lose your sexuality. You lose your ability to be who you are. So stroke actually does a lot of damage. And that's if it doesn't kill you.
Okay. Say I'm with my father, for example, and he starts to act weird. What are some things I can do that can give me a clue that what he's going through is a stroke?
Okay. There's a mnemonic called FAST. F-A-S-T. F means face. So weakness of the face. So if you find that the face is becoming misshapen, it's different, that may be a clue. A means arm. So if you ask somebody to put their arms up and one of them goes down, that means the arm is weak. So that's speech, slurring of speech, not able to get the words out, not understanding spoken word. Those are very important. So F-A-S, the T actually means time, which means you don't have time to waste. You must take that person to a hospital immediately. The brain is a very important organ. It really is very sensitive. And one of the key things about the brain, it doesn't store food. So it needs sugar, it wants it now. It needs oxygen, it wants it now. It doesn't store to use later, which means the blood supply to the brain must be constant. So when there's a stroke, there's no blood supply to the brain. That means there's no sugar, glucose, there's no oxygen. It doesn't store them, so it starts to suffer. So if anybody is going to help to repair the brain, that starts from getting that patient or the person suffering a stroke to a hospital immediately. And we want to be able to reverse what's happening, to feed the brain, to give oxygen to the brain within 3 to 4 hours. Otherwise, the damage is permanent. So if anyone notices that somebody is suffering a stroke, you must get them to a hospital immediately, because that gives us a chance, a fighting chance, to reopen the pipes supplying blood to the brain, get the sugar and the oxygen to the brain so it can start to recover within 3 to 4 hours.
So what is our situation here, though? I mean, in Africa, what's the reality for us here in Africa around that 3 to 4 hour window you just mentioned?
A lot of people don't even know they're suffering a stroke in the first place, so they don't go to a hospital. For those who know or who may have suffered a stroke, they don't get to a hospital until after a day, 2 days, a week, where we can't do anything anymore. So our major problem is getting information to the people about stroke so that they are aware what the symptoms of stroke are and the importance of time. So we said, there was a song before that said, time na money. This one, time is brain. You waste time, you lose brain. Very important.
Wow. Time is brain. You waste time, you lose brain. I like that. So how do we prevent stroke?
The major thing is to watch blood pressure. I think for everyone above 40, 50, you should know what your blood pressure is. You should be checking regularly. So everybody should have a general practitioner or at least some facility that they go to for regular blood pressure measurements. For the average person, whenever you go to a chemist for whatever you need to do, if you happen to be in a hospital, and our hospital should actually offer this as a free service anyway, just check every so often. It's not a big deal. It takes a minute to get a blood pressure check. If you suffer from hypertension, then you should be guided by your doctor. If you don't, just check. Anytime you have an opportunity, just check.
Okay, so make sure we check our blood pressure. What other things can we do to prevent stroke?
The other important thing is diabetes. You need to know whether you're diabetic or not. And so everybody should check that as well. Once in a while, do your blood pressure, your blood sugar level. And the blood sugar level that we're concerned about is the fasting blood sugar, very early in the morning before you have breakfast. And that doesn't have to be done regularly, but you should know every year, just have a check. Make sure everything is okay.
Okay, so we check our blood pressure. We check for
blood
diabetes.
Sugar, yes.
What else should we be doing to
cholesterol is
prevent?
also important. We should check cholesterol. Aside from just checking to know your numbers, as we call them, regular exercise, don't smoke, minimum alcohol. Those are the key things. And one other important thing, of course, is if you have a family history of stroke, if somebody in your family has suffered a stroke before, it means that there is some risk within the family. You need to get to the bottom of what that risk is so you can take a special effort to prevent that in yourself.
I'm glad you mentioned that, because that's one of the Twitter questions that we had too, was that if someone in my family has suffered a stroke, pretty much am I at risk for stroke? So yes, if you have a family history, the answer to that question is if you have a family history of stroke, yes, you are at risk for stroke. And I guess that makes it more important that you make every effort then to prevent stroke. So what about lifestyle choices that we make? What sort of things do we need to do to prevent stroke?
Well, keep fit is very important. Keeping your weight down is very important. So going out, have an exercise, have a program for keep fit or exercise. I go jogging 20 minutes every morning. People can go for a walk, go for a power walk. But just do something regularly. The most important thing, of course, is that it keeps your heart working harder, working more efficiently. So it's pumping blood and, more efficiently through to the brain. Secondly, it keeps your weight down, so you don't have all that cholesterol floating around, which can block the blood vessels to the brain. And it generally makes you feel a lot better, makes you feel alive. So exercise, key, very important.
Very important. So exercise, watch what we eat, keep our weight down. Let me, because I have a passion about because you mentioned the checkups, and I have a passion about that. I'm a real believer in changing the culture in sub-Saharan Africa, and I know there's a reason for it. I know that people are struggling to make a living and to feed their children and send their children to school. So the concept of paying money when I feel well to go and see a doctor doesn't make sense.
Yes.
But that's really what preventive medicine is, isn't it?
It certainly is.
It's doing things that you need to do ahead of time to prevent you being ill. So would you say it's safe to say that if I am, say, 35 and over, I should be seeing a doctor at least once a year, just to know that I'm okay, not wait to get the malaria or the typhoid to go into? Would you say that's a good advice?
It is very good advice. My only caution is that people should be guided by their doctor, because the kind of tests that we need to run depends on age, depends on gender, whether you're a man or a woman. That's important. I don't like the fact that people can just go willy-nilly to a diagnostic center and say, hey, I'm here, run all the tests.
Yes.
It doesn't make sense to us most of the time, because it needs to be specific for that particular person.
Yes.
But certainly going to your doctor and say, listen, I want to do a yearly check, then be guided by the doctor to, prescribe what test you actually need, which will make sense to the doctor, giving your medical history, giving your age, and giving whether you're a man or a woman.
So when it comes to the issue of stroke, what sort of nuggets would you give our audience?
In Nigeria specifically, people think that when you've had a stroke, that it was shot by an arrow, through an arrow by somebody in the village. Well, it's not true. There's nobody cooking stroke and shooting it, here and there. So this misconception that stroke is caused by somebody else is actually not true, and it leads to delays in seeking care or going to places where you won't get help. For stroke, so long as people understand that it is because of blockage or a rupture of the blood vessel to the brain, then it's something that you've caused for yourself in a way because of lifestyle or because of your family history. So you need to find the treatment, and the treatment actually resides in hospital. So we need to get somebody like that to a hospital quickly so we can start to reverse or at least feed the brain to get it, to recover and limit the damage in a way. So getting to a hospital is critical information that people need to know. You must get to a hospital quickly. By all means, phone your pastor and ask that the congregation be praying for you, but you get yourself to a hospital.
Thank you very much, Dr. Ogunbo. It has been wonderful. It seemed like the time has just flown by, and you've given us so much information, and I really appreciate your joining us today on the Health Zone and teaching us so much about stroke. Thank you for being on the show.
Thank you very much for having me.
It's been our pleasure to have you on the show.
Excellent.
Well, I hope you'll come back again. We'll call you back
I
to
will.
do something else for us.
I will.
Okay, so it's been great. We've had Dr. Ogunbo. We've been talking to him about stroke. Don't go away. We'll be right back. So that was a really great interview with Dr. Biodun Ogunbo. We learned so much about stroke. But what we're going to do now is we're going to listen to a patient, somebody who actually experienced a stroke. Let's listen to him and learn how he dealt with it when it happened to him. Mr. Davo Dallas, welcome to the Health Zone. Thank you so much for joining us.
Thank you very much.
So, Mr. Dallas, I know you had a stroke recently. Can you tell us what sort of symptoms you experienced and what you were doing at the time?
We were at a meeting discussing, and I was even the chairman of the meeting. And all of a sudden, I just discovered that I couldn't lift my right leg. And I told my next door colleague that I was having a problem with my leg. He asked me, what do you feel is happening? I think it's a stroke. He says, it's what? I say, it's a stroke. Interestingly, another lady, a member of the council also, was present. And I called her. I said, look, Lizzie, I'm having a problem. And he looked at me. No, Deborah, we must go to the hospital. And they took me to the hospital.
What did she see, though? You told me earlier about something on your face that she noticed.
And what she said, she noticed that the alignment, my eye and the nose were on different level.
Wow.
And that was what she saw and felt, like I felt, like it was a stroke.
So what are you doing right now to take care of yourself with this? What kind of therapies or treatments are you getting?
I had to start relying on the physiotherapist to get me or to put muscles or strength to the right leg and make it a little bit more active. Exercises regularly, you have to be doing that.
Yes.
And number two also is to make sure that I get myself engaged in activities that can brighten my day.
Okay.
Because you have to be very careful that you don't, from that, go to a depression.
Depression, absolutely, because that's a big change,
Yeah.
a big health change for you having a stroke.
Right.
When you think about what you know now, what would you tell someone else out there who's watching this show? What would be your advice to them as to what to do to possibly prevent a stroke?
Well, I can just say that you have to be very, very observant. Everything about your body counts.
Yes.
It's not just having a slight headache or having anything that is responsible for it.
Well, Mr. Debo Dallas, thank you so much for joining us on the Health Zone. Your views and your experience with stroke, I'm hopeful and I'm confident will be of a great benefit to a lot of our viewers. So again, we're deeply appreciative of your being here. Thank you very much for joining us on the show.
Thank you.
My goodness, that was amazing with Dr. Ogunbo. I learned so much. I don't know about you, but he talked about so many things. So I'm just going to recap some of the most important things. The first thing he said is that the single most important thing you can do to prevent stroke is to manage your blood pressure. Yearly checkups are very important. If you have high blood pressure, you should receive monthly blood pressure tests from the hospital, health center, or clinic, and please use your medications as prescribed. Know the signs and symptoms of a stroke, not just for you, but for someone you love. He mentioned the acronym FAST, F-A-S-T. F, facial droop. A, arm weakness or drift. S, slurred speech. T, time is brain. That simply means it's an emergency. Seek help immediately. The best way to prevent stroke from high blood pressure is to take steps to lower blood pressure. And these steps include a combination of medication and lifestyle changes. Changes such as healthy eating, exercising, maintaining a healthy weight, stop smoking if you smoke, stop drinking, and of course, manage your stress. This has been a wonderful show. Thank you so much for joining us on the Health Zone. And as always, this is Dr. Toju saying, stay healthy.